Hi, Miss Smith. My name is April Harrison. I'm a nursing student with TCC, and I just came into your room to do a little bit of an assessment and take some history, if that's okay with you.
Yeah.
Okay, the whole process should take us about 20 minutes, okay? All right, let's go ahead and first verify your name and date of birth.
I'm Edna Smith. I was born in 1990 on July 24th.
Okay, what are you in the hospital for?
I slammed my pinky in the car door.
Oh. When were you admitted?
Yesterday.
Okay. And can you tell me if you're having any pain right now?
Yes.
Can you rate your pain?
4.
Okay. 4. Do you have any allergies?
No.
No allergies. Do you have none to drugs or food?
No.
Okay. Are you currently taking any medicine?
No.
How about vitamins?
No.
An inhaler?
No.
Okay, so nothing. Okay, and do you have any diagnoses?
No.
You don't have asthma or... Okay, all right. And how about any past surgeries?
No.
Okay. All right. How about smoking? Do you smoke?
No.
And do you vape?
No.
No. Drink?
No.
All right, well then I'm going to go ahead and get started with the assessment. We're first going to start with some vitals. Okay, so I'm going to take your blood pressure. I'm going to put the blood pressure cuff on. Make sure I have it in the right place. You'll just straighten your arm out for me. Tighten that up. Okay, and as we do that, I'm going to clean this and we're going to take your temperature, put in the sheath. Okay, all right. Okay, I'm just feeling for her pulse as I'm taking her blood pressure. And I can feel her radial pulse. Blood pressure is at normal. Waiting on the temp. She's already rated pain for me. Pulse ox is at 96. Okay. And as we're waiting on that, I'm going to go ahead and listen to your heart. Now I'm going to go ahead and take her pulse at the peak pulse for 1 full minute. checking her respirations. As we do this, I'm going to listen to your lung sounds. Her respirations are regular. She's taking about 18 breaths a minute. So far, no crackling in any of the lobes of the lungs. No wheezing. All right, and would you go ahead and sit up for me? I'm going to listen to the back. Just take a good deep breath. As I'm doing this, I'm assessing the skin on her back. She has no bruises, no open wounds, nothing that should be alarming, no rashes. Okay, thank you. Lungs are clear to auscultation. And I'm going to go ahead now and clean my hands, don some gloves. I'm going to look at your head, and I'm going to just start assessing your body. I'm going to feel for any bumps, bruises, abrasions. Skull is a nice, even shape. No notable dandruff. Take the gloves off. Clean my hands. Okay, I'm going to go ahead and look at your eyes. Okay. All right, she has perla at 2 millimeters. Mucosa is nice and pink. Moist. Same for her nose. Her nares are even. Go ahead and open your mouth up for me. Okay. We have no white spots. Her mouth looks nice. It's pink, moist. Her mucosa is in good shape. And I'm going to go ahead and look at the ears, and I'm feeling behind the ears just to see if there's any bumps, bruises, any worn spots. I noticed nothing inside the ears. She does not have her jugular vein distented right now. And I'm looking at her arms. I see no swelling. The only place that has a very slight bit of swelling would be maybe a 1+ on the finger that she shut in the car door. And she has good capillary refill. And I'm not going to pinch the finger. I'm just going to touch slightly, as long as it's not giving pain. Okay. All right. And I'm checking for skin turgor. She has no tinting. No tinting. Okay. And I'm going to go ahead, if you will go ahead and lift your arms up for me. How far can you lift it? Excellent. And back down. And then hold them out. And can you rotate? And back. And can you put your hands down and flex back? Excellent. If I push on your arms, can you resist? Good. And how about if you push down? Okay, good. All right, she has good musculoskeletal control. I'm going to say that she is a 5+ on those. And let's go ahead and I'm going to move one leg. All right, so I'm going to have you, as she's going to be doing this, I'm assessing her skin, and I'm looking for swelling as well, which I see no edema, no redness. Go ahead and lift your leg up. And can you rotate it out and back? And can you rotate your ankle inward? and back. And yes, point, and then flex your foot back. Okay, very good. Let's go ahead and lift your leg up. If I push down, can you resist? Excellent. Okay. Can you flex your foot back? And then go ahead and push against my hand. Nice resistance. Okay. Same thing on this side. Excellent. And then can you go ahead and cover this leg, uncover this leg. Go ahead and let's do the same thing on this leg. Lift your leg up, out, and back. And can you rotate? Okay, very good. All right, and again, I'm assessing the skin on both legs. And I'm going to go ahead and feel for pulses. So her pedal pulse. They're nice and strong. 3+. Let me feel for tibial. Okay, those are nice and strong too. And then I'm going to go ahead and clean my hands. And I'm going to go ahead and see if you're able to feel these touches, okay? I'm going to have something soft and I'm going to have something a little bit sharper, okay? So go ahead, close your eyes.
Soft.
Okay.
Pointy. Pointy. Soft.
Soft. Okay.
Soft. Pointy. 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 Soft. Soft. Pointy.
Okay.
Pointy. Pointy. Soft. Soft.
All right. And then we're going to go ahead and check the legs. Same thing.
Soft. Pointy. 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 Soft. Soft. Soft.
Okay. I would do the bottom of her feet, but she could go too much. Okay. All right. So clean my hands. As far as a Braden scale, we have very mild concern for any skin friction or problems with bed sores, so she's going to have a very high Braden scale score. As far as the Glasgow Coma Scale, she's able to tell me, oh, can you tell me what day of the week it is?
It's Wednesday, right?
It's Wednesday.
Yeah, Wednesday.
Okay. And can you tell me where you're at?
I'm at home.
Okay.
I'm at a hospital.
Okay. And you've already told me why you're here and who you are. So as far as Coma Scale, between being alert, awake, oriented, ×4, and oh, let's have you go ahead and grip me. Can you squeeze with both hands? And don't worry about using the finger. Okay, she has good, strong grips. Okay? All right. Thank you. Okay, so Perla eyes were 2+, and then the Glasgow Coma Scale is a 15. And then as far as the skin color being normal, she has no lesions or bruises. Her mucosa is good. And the nail color and brittleness, as I assessed with the capillary refill, I see no brittleness. And on her feet, I didn't do capillary refill. I'm going to go ahead and do that. She has nail polish, so I'm going to do the capillary refill at the back of her feet. And everything is a 2+. Clean my hand again. So, again, Braden scale is good. And then as far as, have you had any coughing lately?
Mm-mm.
No. Any problems breathing at all?
No.
Okay, lungs were clear to auscultation. Cardiovascular-wise, all lobes sounded good. And then, do you take a flu shot every year?
Yes.
Okay. And how about a pneumonia shot?
Yes.
Okay. She is not on any oxygen. And Do you have a regular diet?
Yes.
Are you able to eat frequently? How many times a day do you eat?
I eat 2 to 3 times a day.
2 to 3 times a day. Do you have protein with that?
Yes.
Okay. And when was the last time you had a bowel movement?
This morning.
This morning. Do you have problems with bowel movements? Are you able to go regularly?
Yes.
Okay. And would you say the consistency is hard or soft?
Soft.
Okay. And do you take any supplements like vitamins?
No.
Okay. All right. As far as urine, are you able to urinate without pain?
Yes.
No stinging, burning. As far as odor, do you have a strong odor?
No.
Okay. And then are you continent, meaning like you don't have accidents, you're able to make it to the toilet?
Yeah.
Do you have a frequency in urinating?
Yes.
You need to go often?
Not very often.
Not very often? Okay. Like, you don't go 3 or 4 times an hour?
Yeah.
Okay. And then, when was your last menstrual cycle?
August 3rd. Wait, October 3rd.
Okay, October 3rd. And would you say that it's normal?
Yeah.
Okay. No abnormally heavy bleeding or anything like that. Okay. And who do you live with?
My dog.
Your dog? Okay. Do you have relationships with close family or friends?
Yes.
And how would you describe those relationships?
Good.
They're good? Okay. Do you ever feel depressed or sad? Do you battle those problems?
No.
No. Do you ever think about hurting yourself?
No.
No. Okay. All right. And I'm going to go ahead and listen to your lungs one more time, and I'm going to have you cough. I didn't have you cough for me, but I'm going to have you cough while I'm listening to your lungs. Okay. Do not get cough. Okay. And again. All right. Thank you. All right. Sound good? Do you have sputum or mucus that comes up when you cough?
No.
No. Okay. All right. Well then, patient's not diabetic. She did not need a blood sugar stick. And I believe that's it that we need to go through for today. I'm going to go ahead and clean my hands. Is there anything that you would like me to convey to the nurse?
No.
No? Okay. All right. Then I'm going to go ahead and leave you with the call light right here. If you need anything, you just let us know, okay?
Okay.
All right. Thank you.